It is actually 11 o'clock South African Standard Time. And I want to say good morning, good afternoon, and good evening, depending where you are. And I suggest that we start. We currently have about 127 people. This includes our guests and the 105 people, and the number keeps on increasing. And I suggest that we do start. We had committed to starting at 11 South African Standard Time. Once again, good morning, good afternoon, and good evening, depending where you are. My name is Simpiwe Mabele. I am from the ILO Decent Work Team for Eastern Southern Africa. I have a slight role this morning, and I'll come back later during the course of the webinar. Part of the role or responsibility that I have is just to make sure that the people who have joined us have joined the right webinar. So I just want to welcome you. This is a little welcome. There's an official welcome that is going to be done by somebody else. But welcome to the Masoyise Health Program Seminar, which is on fighting the unrecognized pandemic with a thematic focus on reprioritizing TB, HIV, and non-communicable diseases in the era of COVID-19. So I can confirm that we have people that are in the right seminar, because I don't see the number going down. Instead, I see the number increasing. Before we start, I just want to introduce the person that will be one of the program directors, and I will quickly hand over to her. It is my pleasure and honor to introduce Dr. Spoor Khalamono, who is currently the acting executive director of the National Institute for Occupational Health in South Africa, which is a division of the National Health Laboratory Services. Dr. Spoor is a medical doctor. She's an occupational medicine specialist by training and a senior lecturer at the School of Public Health at the University of Witwatersrand in Johannesburg, where she coordinated the postgraduate doctor's diploma in occupational health for over 17 years, and currently oversees the training of occupational medical specialists. She does sit on several occupational health expert committees, nationally and internationally, and is an executive member of SASOM and an editorial board member of the Occupational Health and Safety Journal in South Africa. Her current interest is in the field of mental health in the workplace, looking at the workplace risk factors for mental health and how workplaces are opportune environments for interventions. Without wasting too much time, Dr. Spoor will actually be the program director, and I would like Dr. Spoor to unmute her microphone and take over. Thank you very much.
Thank you very much, Mr. Simpiwe, and welcome to all the guests. I will switch on my video. Thank you for that introduction. I think maybe before I continue, it's just proper for me to introduce you, Mr. Mabele, as you have done the honors to me. It is my pleasure to introduce to you my co-program director, Mr. Mabele, who has advanced degrees in education and educational psychology, postgraduate diplomas in labor law and public health, and a qualification in managing HIV/AIDS in the workplace, about 19 years experience in HIV and AIDS. He has broad experience in management of training and development, design, planning and implementation of HIV/AIDS workplace strategies. Also has proven success in developing training materials on HIV prevention strategies and facilitating training workshops. He also has expertise in managing and encouraging project teams to achieve goals and objectives, and has developed and implemented high values and cost-effective programs. Of note, he's also highly skilled at providing coaching, guidance, training, and development practices to internal and external clients. And throughout his life, he's worked as long and as hard as he possibly could to effect beneficial changes in both the workplace and the society at large to establish partnerships. So thank you, welcome. My co-program director, I will hand over to you a little bit later on. So I think it's befitting for me now to welcome everybody and maybe just go it by observing protocol. And to the program directors, to Advocate Thabo Mokoena, the Director General, Department of Mineral Resources, to Ms. Zanele Matala, Vice President of Minerals Council, South Africa, Chairperson of Masoyise Health Program, and our host, to Dr. Lusika Ditu, Executive Director, Stop TB, Dr. Shannon Hayder, Deputy Director, UNAIDS, Ms. Alette Vafanlio, Director, Sectoral Policies of the ILO, Dr. Marike Winrocks, Chief of Staff, Global Fund, Dr. Owen Kalua, WHO Representative to South Africa, Dr. Willie Amisi, Senior Program Officer, SADC, Mr. Vosi Mabena, Organized Business, MIASA, Mr. Paliani Chinguo, Research and Information Officer, SATUK, and all our fellow speakers at this webinar, and our panelists and the organizers of this seminar, and to all of you participants, ladies and gentlemen. You are welcome to this Masoyise Health Program seminar. We all know that COVID-19 has negatively impacted the world in many ways. Within the health context, amongst others, it has diverted attention and resources from all health programs. And this includes HIV, TB, which we are more versed with, especially within our context, and of course, non-communicable diseases, which are diseases of lifestyle. It was with this realization that Masoyise Health Program decided to host this seminar with the purpose of reprioritizing and sort of refocusing attention to diseases that I have already mentioned. So in this seminar, we will attempt to do this by firstly showcasing work that has been done by Masoyise Health Program and progress that has been made thus far. And then in our program, the first part of our program, we will be followed by exploring how TB, workers' health, and health systems have actually been impacted by the COVID-19 epidemic. And then in the latter part of our program, we will finally look at finding mechanisms or solutions for refocusing our efforts through leveraging interventions and resources from COVID-19. But before we kick off, I'd like to request my co-program director to let us in on the webinar etiquette and the ground rules so that everything works smoothly. Over to you, Mr. Simpiwe Mabele.
Yeah, thank you very much, Dr. Spoor. I must say, I feel very humbled to be associated with this initiative that is led by Minerals Council South Africa, together with organized labor, government, other partners, including support from ILO, WHO, and UNAIDS. It is my pleasure now to share maybe a few webinar etiquettes. Just like any gathering where we bring people together, we definitely need at least to outline some few pointers in terms of how we're gonna function. I know at this point we do have 226 people, and I want to share 6 quick points in terms of how we're gonna run this webinar. Firstly, I really would like to encourage people who are joining maybe to use the chat box by introducing themselves. Number 2, We would encourage maybe the use of videos. If you are not speaking, maybe you switch it off, but when you speak, you switch it on. This will really allow us to manage the bandwidth since we are in different locations. I do want to emphasize that our guests, particularly the people who are joining as attendees for this webinar, to use the Q&A functionality for any questions they would like to ask, not to use the chat box. In this way, it allows our team that is working behind the scenes to be able to look at the questions, provide the necessary answers. I also would like to alert everyone that this webinar is recorded. And by joining this webinar, we want to indicate that you've consented to be recorded when your time to speak comes. Finally, I once again want to encourage you to use the Q&A for any questions you have. Other than that, if there are comments, you want to introduce yourself when you enter the webinar, please use your chat box to introduce yourselves. Dr. Spoor, I would like to hand over to you so that we can start the program. Thank you very much.
Thank you very much, Mr. Mabele. I think we need to consider time here. The program is very tight. So I will not waste any more time, but maybe just go straight to introducing our first speaker. Our first speaker is Ms. Zanele Matlala, who has extensive experience in the financial services and mining sector. She is currently the Chief Executive Officer of Mirafe Resources Limited. She is a non-executive director of Dipula Income Fund, Stefanuti Stocks Holdings Limited, RAC Limited, and Royal Bafokeng Platinum Limited. Ms. Matlala is the Vice President of the Minerals Council South Africa and the Chairperson of Masoyise Health Program. So we have the best person to speak to us about the Masoyise Health Program. Thank you so much, Ms. Matlala, and over to you.
Thank you for that introduction. Program directors and all our esteemed guests, ladies and gentlemen. On behalf of Masoyise Health Program, I thank you all very much for the interest and your participation at this webinar on reprioritizing TB, HIV, non-communicable diseases, and other occupational diseases in the mining industry. When we conceptualized the seminar, it was in the middle of the COVID storm, and we purposely decided that we needed to remember and refocus the attention on the perennial diseases that have plagued our industry for decades. We cannot allow COVID-19 to make us forget the commitments we have made as an industry and as the Minerals Council. We therefore welcome and appreciate the panel we have assembled here today. We have with us world-class experts who will share with us as a country and as the mining industry across the continent on how best we can still make a difference this year on our usual programs. The year 2020 will be remembered worldwide for COVID-19, which is a small virus that has caused havoc in all our lives with a devastating social and economic consequences. As an industry, we did not survive unscathed. By this week, we have recorded around 17,500 cases and 190 deaths from COVID-19. And this is out of a total population of around 350,000 employees who are back at work out of a total workforce of 455,000. Although our case fatality rate is less than half that of the country, more than half of our deaths have been of employees who were more than 50 years old. I think someone is not on mute. So whoever it is must mute themselves. I was just saying that more than half of the deaths that we experienced were employees who were more than 50 years old. Further, where medical history was known, 84% of those that died had comorbidities, and this was despite risk ranking for vulnerabilities having been done and some workers being kept away from work. There was no foolproof measures, as even some of the vulnerable employees who were at home still contracted the disease and died. We were caught between a rock and a hard place and did our best in the prevailing circumstances. At this stage, I would like to refocus, starting with introducing you to the Masoyise Health Program. In a nutshell, Masoyise Health Program is a Minerals Council-led. It's a multi-stakeholder initiative whose genesis was in 2015. It was established with the purpose of improving the performance of the industry on management of TB, HIV, non-communicable diseases, and other occupational diseases. It has been very instrumental in assisting us to fast-track progress in meeting industry targets set by the Mine Health and Safety Council and by ourselves. Our success as Masoyise Health Program lies in the partnership we have with various stakeholders, the Department of Health and Mineral Resources and Energy, organized labor, the UN organizations, South African Business Coalition, Occupational Diseases and National Health Laboratory Services. Each and every one of these stakeholders has, over the past 5 years, played a role in challenging us and motivating us to do better. And we have found that there is strength in unity. Some of our achievements have been an efficient electronic reporting system that made it possible for the Minerals Council and its members to report on progress made regarding the 2024 milestones set by the Mine Health and Safety Council on TB and HIV. This enabled us to show consistent improvements in reporting and performance from 2016 to 2018, where a peak of 90% of employees were screened for TB and 83% counseled for HIV annually. We identified a slight regression in 2019, and there has been a major disruption, as to be expected, in reporting performance in 2020 due to the COVID-19 epidemic. Another improvement has been the strengthening of TB contact tracing in the high prevalence districts and adding a contact tracing module to our electronic reporting system. Regular TB contact tracing meetings led to companies learning best practices from each other, and they were galvanized to do more on contact tracing, which is one of the bedrocks of TB control. Without contact tracing, it's difficult to control TB. We pride ourselves in grounding our actions on empirical evidence. In line with this, we have conducted a number of valuable studies, particularly in the past 2 years. To mention a few, we conducted a study on the TB and HIV services in the coal sector. a study on TB mortality in the industry, and a study on health promotion and behavior change that would assist us with management of non-communicable diseases. The results of all these studies have shown a light in areas that needed strengthening, and we are the better for having conducted them, as we are now implementing recommendations made in those studies. Most of our recent achievements was made possible by our partners, the ILO and UNAIDS, and is a publication on the Masoyise Health Program highlighting our journey since inception. Most of the attendees to this webinar would have received a copy. Once again, we'd like to thank the ILO and UNAIDS for their support. As already stated, we shall not be defeated by COVID-19. In all adversity, opportunities are brought. It is the opportunities on which we want to focus to improve our programs. With COVID-19, we have been forced to innovate, and it is that same approach that we need to use to innovate in our fight against the pre-existing diseases. The COVID-19 screening apps that we use currently can easily accommodate TB screening. We can ensure that going forward, all employees that attend our occupational health services and any health facilities are counseled for HIV. The manner in which we scrupulously attended to our vulnerable employees with hypertension, diabetes, and other chronic conditions is the same manner in which we can continue to manage them to optimize their health for the future. We are in an even better position to support employees with chronic diseases, as many who were previously unknown declared their conditions due to vulnerability to COVID-19. We hope to hear and learn more at this webinar about what we can do to neutralize the impact of COVID-19 and end the year on a positive note. The health and well-being of our employees in the industry is paramount, and we will do all it takes to ensure that we save lives and improve health. Thank you very much.
Thank you so much, Ms. Matlala, for that informative introduction to the Masoyise Health Group and all the good work, extensive work that has been done thus far. It's very impressive to realize that even throughout COVID pandemic and throughout the lockdown and before, a lot has actually been achieved. So thank you so much for your leadership as a chairman of that health program. That was an introduction to the Masoyise, and the next part of the program focuses now on the problems as we are facing. But before we get into that, I think I need to mention to you that the Honorable Minister of Health, Dr. Zweli Mkhize, was supposed to have welcomed us at the start of the program. He unfortunately has been called for an urgent emergency outside, but we will accommodate him as and when he comes later in the program. So for now, then we will focus on the three speakers who will address this, or state the problems that we are facing. And then thereafter, there'll be an opportunity for a Q&A session. Please do feel free to type your Q&A, your questions on the Q&A window. Let's rather use the chat for general chats, but all the questions, can we just please type them on the Q&A window. We do have panelists who would address the questions, and also at the end of this session, we will have a short Q&A or question and answer session where verbally, some of the speakers and the panelists will be able to address the questions. So please feel free to go ahead and send your questions through. Should we not be able to answer all the questions, we will endeavor to address them at a later stage, and all people that have logged on to this webinar will receive the answers to the questions that we might have not been able to address in this seminar. So in the interest of time, I think I should go now to the next speaker, the first of the three speakers, which is Dr. Lucika Ditiu. I'm going to introduce her now. She is the Executive Director of the Stop TB Partnership. Dr. Lucika Ditiu is a Romanian physician, accomplished professional and relentless leader in the global fight against TB and other communicable diseases, driven by the strong belief that we should leave no one behind. Over the years, she transitioned from being a physician to one of the strongest advocates in the internal community on tuberculosis. Under her leadership since 2011, the Stop TB Partnership has evolved into a lean, innovative, and progressive team that represents one of the most influential advocacy voices on global health and TB, providing support financially, as well as TB medicines and diagnostics for the global TB response, with an ambitious agenda of transparency and accountability. So today, Dr. Ditiu is going to talk to us about the impact of COVID-19 pandemic on TB responses in high-burden countries. Over to you, Dr. Ditiu, and thank you for accepting our invite.
So first of all, thank you so much. And it's me to thank you for inviting me, but more important than inviting me to manage to have such an amazing gathering, and it's such a great audience, and also to putting such a great agenda. And the last thank is going actually to the work that is done with the entire program over the years and the great organization as well of this seminar. So, you know, we in Stop TB Partnership were very much connected to the South African realities for a long time due to the fact that the leadership of our board was into the hands of the Minister of Health of South Africa, together with Joan Carter from Results for a long time. And also because we were having as board members ministers of health from Southern Africa sharing similar concerns in terms of the TB epidemic and vulnerable groups. So we had very many discussions for a long time. And actually, when I joined in this job already in 2011, and 2012, there were already initial discussions at that level in the board, I want to say. You were having them already before, on how to address and how to ensure not only the visibility of TB in general, but also TB at workplace. And out of the many workplaces, mining sector being so important. So in August 2012 in Maputo, the heads of states of SADC signed an historical declaration on tuberculosis in the mining sector. And we had a pretty important role in advocacy for this declaration, which recognizes that the mine workers are disproportionately affected by TB and committed several actions by the SADC countries. And I also recall a very important cross-region meeting that was held in South Africa and actually chaired by Minister of Health of South Africa, and I think the Minister of Mining sector or the minerals and mining was fully present, and there were representatives from the other neighboring countries in discussing this important part related especially with prioritizing TB in the mining sector for action as being an important driver of the epidemic in this region. So we know the topic that I have is about TB and COVID, and I will address this. But I just want to say that, over the last several years, there was and there is progress, and I think also Dr. Matlala also outlined some of this as well. And there were also investments from the World Bank as well as the Global Fund in the form of this regional project on mining on TB, as well as the resources that were coming from the governments and from the companies and so on. The rates of TB in mining are still high, but there was progress that was recorded with a slight decrease, as well as progress made on prevention and care for silicosis and TB, as well as dust on occupational health services. So that we had in 2018, the UN high-level meeting on TB, there was a very strong declaration, political declaration coming out of it, specifically referring key populations and also speaking about trying to find, diagnose and treat everyone that is in need of a TB diagnosis and treatment. And there was a pretty good work that took place in 2018. And 2019, we felt we did very well. So at the beginning of 2020, there was a lot of hope that we can see a change, in the landscape and see some very, very clear progress after some years of push, 16, 17, 18. However, as we all know, COVID came to us in unfortunately changing the lives of each and every single one of us. And unfortunately, the TB programs, the people working in the TB programs, as well as the facilities for TB, were heavily impacted due to the similar nature, in a way. Both airborne diseases. The symptoms are, at least in the beginning, somewhere the same. Health workers, because of their specialty in respiratory diseases, a lot of them were diverted to COVID. I speak in general, right? I'm not referring specifically to the region. But we know it happened here as well. Hospitals and dispensaries and beds were also diverted, also because in TB, in a lot of places, infection control measures were at least some in place that was considered, trying to avoid the circuits with people. And in addition to this, we all know that there is a big due to the lockdown, limitation on the movements, the access of people to getting diagnosis and treatment was limited. And we did a study early in May 2020, this year, together with Hopkins and Avenir Health and Imperial College. And, the impact was terrifying because it showed basically an increasing of the global TB incidence of almost 7 million people, and the death of around additional 1.5 million people between now and the beginning of 2025. So, and that modeling, like all modeling, we all know very well, included some thinking and some variables there. And one of our variables there was that we will have 3 months of lockdown followed by a 10 months comeback. And unfortunately, those variables showed to be weak because, as you saw, the lockdown was longer than 3 months in several places, but also the comeback is not really happening. And what we are seeing now, as we all know, in a lot of parts of the world, is actually a shy but unpleasant return to a lot of restrictive measures due to the disruptive increase in the number of people with COVID. So the TB, this is why all the cases that are were obviously in the first 6 months of 2020, we know for sure that there is a drop of around 30–40% in the TB diagnosis globally. And probably by the end of the year will be a minimum of 25% drop. So we know that this will have an impact, unfortunately, in people that will die and in people that will transmit the disease. So we will expect that the TB incidence in deaths in 2021 would increase, and unfortunately will look like the level of figures that we had in 2013 and 2015, a setback of 5 to 8 years, which in the fight against TB. So, but that's why we all know that this is happening. And we all know that, to be very clear, is not just for TB. I think for TB is more impacted because the resources, the human resources, beds and stuff, are diagnoses are somehow borrowed to COVID and the people are not physically there, and it's a bit difficult to handle that with the healthcare workers pushed in the different directions. But we cannot be like, okay, there is a problem and stay and be paralyzed of fear, because we really need to continue what we started. So we discussed a lot with all our partners, and as well, obviously, with the Global Fund, which, as you know very well, is a biggest funder, external funder for TB, even though the amount is really, really small, and discuss what should happen is, we said that there are three major things that we should do. One is to really ensure that the focus on TB efforts are not being lost, and that will imply conversations like these ones, but also, advocacy and maintaining the efforts that the heads of states, the ministers of health, as pressured as they are by the public and politics to really address COVID, and they will have to think that there are other diseases, including TB, which is also airborne, that they will have to keep in mind. The second thing is, you see, in TB in general, the financial resources were always a problem. We observe in some, it's true, Asian countries so far, a diversion of resources from the TB programs towards COVID. Probably is happening for the rest, but we didn't check on that. This is really bad, because you kind of take from a weak one, you make him even weaker, because the TB programs never had more than 50% of what was needed. So maintaining the financial resources to fight will be important. And the third is, you really need to be smart to restore the diagnosis, treatment, and prevention. And that will imply, you see, it's not easy. And we all know that things done very big in rush. We all saw a lot of procurements done in rush that left space for either being criticized or, bad people then using that for their own interest. So things that are done in rush are not are not easy. But it's not the time too much here to stay and think. Rapid action is important. So a bit of risk taking and flexibility in the systems will be needed if we want, in the coming part of 2020 and 2021, to see a going back to the levels of before. And also it implies a bit of thinking, and this I'm going towards the closing of my points, which are related to doing things in the same time. For sure, diagnosis and case finding for TB and COVID can be done in the same time. And I know for sure that is happening already in some parts of South Africa, and is happening in other parts as well. The Indian government announced that they will do that countrywide, using, in some instances, a lot of mobile units and a lot of mobile approach that was developed for TB that can be used as well for COVID, obviously respecting all the infection control measures and so on. I think it's also very important to bring, so you can do things in the same time. Bringing digital health and artificial intelligence will be very important, not only for connectivity, and even the small thing of ensuring connectivity will be very important for some of the communities, but also it will be very important to think of the artificial intelligence. And when I say about diagnosis, there are now mobile X-ray units. Some of them can be literally taken into a backpack, and you have connection with artificial intelligence. You don't need to have, you have direct connection to artificial intelligence. You don't need to be there with a doctor and all the team. It can be transmitted somewhere. Somebody reads the X-ray. Of course, for COVID, if you arrive at the phase of X-ray diagnosis, it's a bit late, and people are probably diagnosed through other ways, but you can monitor the progress, and you can obviously diagnose and put an assumption of a TB using that. As well as we are all faced with treatments, and people are in these times need to take the TB treatment as other treatments, using different adherence tools. And we developed a lot in TB due to the so-called DOTS program, in which we consider that for a long time, thanks God, we walked away from that. People need to be seen swallowing the pills directly. There are other ways to monitor the treatment these days that are really very smart. So what I want to say is South Africa was always at the forefront of the TB control and TB response. And we are very proud as Stop TB to be so much linked to South Africa, which for me, for many years, was like a second house. So I miss very much to be there, but also because South Africa was the first country to introduce GeneXpert as the initial test for TB and also scale it up. years ahead of other countries, also leading in new drugs, new regimen for drug-resistant TB, and as well, I have to say this very clear here, a leader in prioritizing the needs of key populations, including recognizing the needs of the mining sector. We will have our board meeting happening in November, in like a month, and we plan to have a roundtable on TB financing in Africa. The Honorable Minister, who is also a board member for us, will hopefully join us. Because we want to discuss how we can collectively work on a catch-up plan to mitigate the impact of COVID pandemic on TB, especially looking at south-to-south learning, which is extremely important, but also using the fact that private sector, which is a sector with which we as Stop TB are very proud to be so much associated, has a lot to contribute, a lot to learn us in the know-how, in the speed, but also in measuring the successes. So I think we as I like to say shoulder to shoulder with all of you in Stop TB to help in any ways and support in any ways. We did that as much as we could in the past. We don't have the resources of the big donors, but sometimes pushing together will ensure the resources. It's very important because I really believe in the capacity of addressing the mining sector, not just the people, but also their families and the communities where they come from. It was one of the first discussions that we were having in our board when I joined, and I will continue to do that and remain committed to this fight. Thank you very much.
Oh, thank you so much, Dr. Ditu, for such a comprehensive account of where we are and also where we can go and what options do we have, you know. Maybe just taking a few notes from what you have said. Yes, we do know that resources have actually been diverted, you know, hospital beds, some hospitals have actually been dedicated to COVID-19. And because of the lockdown, really access to diagnosis, access to treatment has been a problem. And really we've come very far. You know, South Africa has been a trailblazer in making, you know, all the efforts, maintaining efforts around TB infections. And I'm sure the world is going to come back to South Africa, ask now, South Africa, now that we have COVID, what are we going to do? So we need to sort of take the baton and be able to proactively look for new innovations and for interventions, because people are going to ask us questions. And I also liked the fact that you did say that we need to intentionally prioritize diagnosis, treatment, and prevention. And you also mentioned a few solutions, including exploring new methods like artificial intelligence, and of course, not being stuck with COVID, but running parallel programs so that we can address all the other diseases and not win in one area and lag behind in other areas. So thank you so much for also including the smart ways of how we can prioritize, especially key populations like the mining population, and also using the private sector for other issues and partnering with important stakeholders, especially for the dollars, but also for assisting us with measuring successes. So thank you so much for your kind presentation, Dr. Ditu. Thank you. So it's our pleasure. So I need to move on now to I did say we have 3 presenters. So the second presenter is Mr. Baliani Chingu. In occupational health, occupational health is enshrined under a principle of tripartism. There is nothing that we can do without consultation or inclusion of it's the state, business, and organized labor. And hence we have asked Mr. Baliani Chingu to grace our occasion. As introduction, Mr. Baliani Chingu is currently a doctoral PhD candidate at the University of Witwatersrand in Johannesburg. His PhD research topic is on occupational health and safety for clinical officers in Malawi. For 8 years since 2012, he has been working as a program officer responsible for research and information at the Southern Africa Trade Union Coordination Council, for which he has coordinated various regional research activities, including a recent study on the impact of COVID-19 pandemic on working people in Southern Africa. Prior to that, for 5 years until 2012, he served as a researcher and later as director of research at the Malawi Congress of Trade Unions. So we really do have one of the best organized labor members to tell us about the impact of COVID-19 on workers' health. Thank you, Mr. Baliani Chingu, for accepting our invite and for preparing this presentation for us. Over to you, sir.
All right, thank you, Madam Director of Programs, and all protocols observed. I hope my audio is loud and clear.
We can hear you, Mr. Baliani. We just need to increase the size of the presentation. I think it's still a little bit small. Yes, that's correct. You're good to go.
All right, thank you, Madam Director. Once again, my name is Baliani Chingu. I'm representing the Southern Africa Trade Union Coordination Council, which is the regional organization that represents workers in the Southern Africa. To start with is probably to express our gratitude on behalf of the leadership of SATUC and the members of SATUC in the 14 of the 16 SADC member states, that we are grateful to be part of this important discussion this morning, discussing on the important subject matter before us, and to be allowed as well to chip in to share some insights on the topic. My role this morning is to share just a few insights from the trade union perspective on the impact of COVID-19 on workers' health, and also touching on the implications of that when it comes to the HIV, TB, and other non-communicable diseases. To begin with, the perspective of workers is that the COVID-19 pandemic has just amplified the challenges that workers were already facing before the pandemic emerged. Workers have been facing a lot of challenges that include increase of insecure and informal work, lack of social protection, rising of unemployment, which contributes to the dwindling of quality of health, increase of poverty and inequalities. Now, COVID-19 comes in against this background, and as workers, the anticipation is that we will witness the escalation of incidences of various problems or health problems among working people, including HIV/AIDS, TB, and other non-communicable diseases. As we stand, probably the picture is not yet clear on the impact of the COVID-19 with regards to health of workers, but we anticipate that as we go along, we will be witnessing the critical or devastating impacts of the COVID-19 on the workers' health. How will this manifest as we envisage as workers? There has been an impact on job losses and loss of livelihoods as a result of COVID-19, whereby workers have been losing stable jobs with adequate medical insurance, and there has been an increase in unemployment and precarious work. as a result of the job losses and loss of livelihoods and so on and so forth. So we have a pool of unemployed people that are being pushed into the informal economy to engage into unpredictable and informal jobs, which offer little in terms of job security, decent work, social protection, and so on and so forth. In that regard, the workers will not be able to earn enough as they used to when they had the stable jobs to cover for their basic expenses at the households. We are talking about cost of housing, food, and also the cost of healthcare. As a result, this might impact on the workers in terms of debts, in order to fend for their livelihoods, anxiety, stress-related illnesses that also have got a bearing on poor nutrition and long-term health problems because the sources of income have been taken away as a result of the pandemic and means of livelihood disrupted and so on and so forth. So in the long run, we should anticipate the burden on the state in terms of health expenditure increase to address these health problems emanating from the job losses as a result of the COVID-19 pandemic. So this is just a snapshot of the picture, how we see it as workers. Right, the last part of my presentation talks about migrant workers, the situation of migrant workers. The first slide, I just talked about the general picture. But quite often when we are discussing issues like these, there's a segment of, or a category of people that are marginalized or left out in discussions. These are the migrants. And having talked about the and then the unpredictable and informal employment that emanates from the job losses that we have seen amidst COVID-19. The most important aspect is that these unpredictable and informal employment or jobs that we are talking about, that people are being pushed to as a result of loss of stable employment, are the migrants in our countries who are prone to engage in such kind of precarious work or jobs and so on and so forth. And as a result of that, we have seen or we have received reports from our members in the SADC member states that there has been an increase of vulnerabilities of migrant workers in terms of well-being and access to health. There's a recent study by Pascal Yav, a student, a postgraduate student at the University of Witwatersrand in South Africa, who has confirmed this as feared by the workers, that as a result of COVID-19, vulnerabilities of migrant workers has been increased in terms of well-being and access to health. How has it been the case? Firstly, there's been an increase in levels of stress and depression amongst the migrant workers. For example, some of them have lost loved ones due to COVID-19 or other ways. And because of the lockdowns and so on and so forth, they can't move across the borders to bury their loved ones in their home countries. This has been a source of stress and depression, mental health, aspects of mental health and so on and so forth. And secondly, sense of disconnection for some migrants and lack of belonging due to extended stays. They have been locked in those countries where they had gone probably for short stay, and then lockdown came and they can't move back to their countries. And discrimination that they face, xenophobia and so on and so forth. All these have been factors that have impacted on the mental health of the migrants, as confirmed by this recent study by a young scholar from Wits University. And secondly, we can also talk about reduced health-seeking behaviors due to expiry of papers. The lockdowns have found some migrants having their papers expired, such that when they go for medical care, the first question is to say, can we see your papers? Your papers are not in order, they have expired. And then probably you risk arrest. So for some migrants, they would rather not, when they fall sick or when they need attention in terms of HIV or TB and other diseases, they would rather not go to clinics for medical attention because their papers have expired and they might be, arrested and be deported and so on and so forth. So that has been seen or has been confirmed by this study that it has been the case for migrant workers. And also, last point would be lack of social protection for the migrant workers. They are being discriminated against in some of the countries in the region when it comes to social protection related to COVID-19. Even though some of them would have their papers in order, residence permits and work permits and so on and so forth, but they are being discriminated against. For a good example would be probably in some countries, without naming the countries, you will find that there are provisions that if you were outside the country and then you are coming back into the country as a resident or as a citizen, you have to undergo quarantine for 14 days and then be tested at the end of 14 days. And then depending on the results, if you are negative, then you proceed, you go home, right? So in some of the countries in the region, right, the expense of quarantine is being footed by the state. They will take you to the hotel where they give you food and so on and so forth and take care of you for the 14 days and then you do the testing. But for migrants who are residents and have got papers, they have been asked to foot the cost, right? If you were outside, you had gone home and then lockdown started and then you are coming back, you have all the papers, you have to foot the cost. But for the citizens, the state takes care of the cost. So there has been that kind of discrimination in terms of social protection. Good examples are so many, but just to give one isolated case. So this is how the COVID-19 pandemic has had an impact on working people in the region and migrant workers, which we had wanted to share in this virtual meeting as coming from the workers. At this juncture, Madam Director, I think that's all in a nutshell, because the purpose was not to go deeper into the nitty-gritties, but just to give a snapshot and or stimulate a discussion on how trade unions perceive the impact of COVID-19 and how this has got implications on the HIV, AIDS, TB, and other communicable diseases as far as workers.
Okay.
With that, let me stop there. Thank you.
Yes, no, thank you so much, Mr. Paliani. You indeed have managed to give us an account of how you saw it being close to the workers. And of course, the time is too short for you to go too deep, but it also allows us to be able to have robust discussions later on. One or two things that actually interested me in your presentation was the issue around migrants, just depicting the picture of how well, how they have been severely hit by the epidemic, especially around the issue, the mental health aspect, the mental health issues. Being away from home for extended periods of time. We did experience during lockdown, even in South Africa here, that most of the people did somehow experience depression and anxieties just by being locked inside their homes and not being able to leave their homes. So one can only imagine how difficult it is for you to be in another part of the country, having lost your loved one, but not being able to bury them or send them off properly. And there have been reports of suicide, increasing suicides and increasing mental health issues, of course, because of a whole lot of issues, including, poverty, lack of food, and not being able to afford necessities of life. So thank you so much. We are talking about, health, and access to health becomes so important. And if you are around a health facility, but because you haven't been able to renew your papers, then you can't access health, that also becomes a problem. So these are just the issues that I'm highlighting that we should think of as we go into the second session when we're thinking about solutions. Because the solutions should not only be high level, but should also be able to pick up on the salient issues that you have identified as one who's working closely to workers, especially migrants in this instance. So thank you so much, Mr. Chikungo, for that presentation. So the next presenter, which is the last one for this session, is Dr. Willie Amisi. Dr. Willie Amisi will be talking to us on impact of COVID-19 on health systems in the SADC region. He holds an MBCHP degree from the University of Zambia and an MPH epidemiology from University of Pretoria, and also a PhD epidemiology from Columbia University. He has 22 years of progressive experience in public health and clinical medicine, and currently working as senior program officer at the SADC Secretariat. He is responsible for SADC Health Desk, where he specifically deals with regional health policy development and coordination. He has previously worked in various capacities with quite a lot of organizations, international organizations, including the WHO. So thank you so much, Dr. Willie, for accepting our invite to talk on the impact on the health systems at large and not only on specific diseases. Over to you, sir. Thank you.
Okay, thank you, Chairperson. Good afternoon, colleagues and invited guests. I'm very privileged this afternoon to talk to you about the impact that COVID-19 has had on the health systems in the SADC region. So we are based in Gaborone, the SADC Secretariat, and as the chairperson indicated, my office's role is to support member states in building, strengthening health systems, and this passes through policy making, policy implementation, and policy coordination. So all those issues come through my office, and we provide support to member states in addressing issues of regional importance. Now, allowed, I can just share my screen. I have a short presentation, and I'll really go through quickly, just to give the perspective as a snapshot of the situation in the region. So let me just give you a quick outlook globally on the continent and also in our region. The cases of COVID have continued to increase, in some places slowing down but increasing nevertheless, and in other places we're seeing the reverse of trends. So on the African continent, if we take the 47 WHO Afro countries, we have close over 1.2 million cases and 35,000 deaths, which, and then in the SADC region, we represent closely about 64% of those 47 countries in the region. So we have quite a heavy burden of COVID-19 at the moment, spanning from the time the pandemic started in the region early in March up to this time. But if we were to take the entire continent with non-WHO Afro countries, and we represent slightly over 50% of all the caseloads on the continent. So this is how the epidemic has evolved in the on the continent. We can see that we had this peak, the sharp rise in cases which started around mid-May and started coming down somewhere around end of July and so on. So, and the death as well. But in the last week of September, we saw again numbers of deaths on the continent going a little bit up, including in the SADC region. We have seen some rebound in those numbers in the past few weeks. I want to show this graph. This is a South African epi curve. Many people will be familiar with this kind of curve, what we taught in AP 110. This is the typical bell-shaped curve. So we normally teach our students about this kind of shape that represents a normal distribution of cases. I want to congratulate South Africa for having actually reached the level at which they are today. And I'm bringing in South Africa in this presentation because for us as SADC, South Africa is a major hub for almost everything, for travel, for business, for and also for a movement of people, exchanges, person-to-person contacts and so on. So when we are seeing this picture in South Africa, it gives us hope that we have an opportunity to be able to really suppress this epidemic and get out of the acute phase, to get to the point where we'll start managing this epidemic as any other seasonal disease or any endemic disease that you can pick up here and there anytime. So we are very happy with this situation. As long as it stays the way it is, that curve keeps on flattening and goes back to where it was in April, we'll all be very happy and to open business. For instance, business will open, travel will open, and the region can restart again, including health systems that I'm about to talk about today. Now, just follow up to that, in the region, we have most of the countries reporting decreasing cases. The cases of COVID-19 are going down. However, we still have 3 countries that have not really turned the corner around this disease. That's Lesotho, Botswana, and Angola. But we are hopeful that with all the measures that they have put in place, we'll start seeing the suppression of that curve as well. In the past few weeks, Mozambique has stabilized, but the numbers are still high. We're not really in the comfort zone there, but we are hopeful that once these 4 countries also kick off the downtrend trip, we will be in a safer place to think that we can get out of this acute phase of COVID-19. Now, what has been the impact of COVID-19 on the health system? The first one is actually the health workers themselves. We have seen a lot of my colleagues who came before me was talking about the health of workers. I'm talking about the health workers. So the health workers have been affected to varying degrees in many countries. If I could remember here and there, I remember in South Africa, around July, they were reporting about 5% of all cases were among health workers. And we know that when a new study is done, that figure could either change upwards or downwards. So this has been a big issue that has affected the health system. The next one is the deployment of personnel to emergency response activities. These are taken from routine services, other essential services, and they are sent to emergency response activities. That has also had a serious impact in many member states on how the health system functions. And then the downscaling of routine services. I'm giving an example here of elective surgery. Many will remember that at the beginning of this pandemic, there are places when we did not know so much. There were hospitals or health centers when they find a staff positive of COVID, they'll either shut that ward or they'll shut the hospital, they'll close the hospital. Thank God our knowledge of how to manage COVID-19 has evolved. We are not seeing many of those events anymore, but suffice to say that routine services have been severely affected, and things like routine immunization stand out among the services that have been seriously affected. And this has been due to many reasons. Borders were closed, the transport was limited, countries could not get vaccines that routinely normally come from outside the borders, and the supply then went down. We saw a decline in number of children being immunized or vaccinated during this period, and that will have a long-lasting effect when we consider that these vaccines are actually life-saving interventions. The other thing is patients were just scared to go to the hospital, either because they'll be branded to be COVID-19 positive, or the health workers were not there, or the services were simply shut because there was no one to attend to patients. And the last one, which is not the least, was just the slowing economic activities, which health systems work with a performing economic system. If the economy is down, the health system cannot stand up. So the slowing economic activities due to lockdowns and other economic measures that were put in place also impacted the health system to some magnitude. Now, in this slide, I'm just showing, there was a study that was published by WHO in September, and we reworked that study, we re-studied it, we adjusted it to SADC member states who responded to that survey. And the findings were...
Dr. Willie,
yes,
may I just interject? You only left with about 1.5 minutes. If you could start wrapping up, please. Thank you.
Okay, let me skip this one. And then what we are planning or working on the health system recovery is one, to sustain the infection control among health workers, scaling up the testing, strengthening surveillance at point of entry, which the SADC Council of Ministers has just approved a guideline, a protocol for all member states to implement for this surveillance at point of entry. So when that is is implemented by all member states, we hope that countries will be able to pick cases before they even cross the border, and it will be a big plus to the control of the spread of pandemic. I think the next one, well, let me stop here in the interest of time. There are other measures. I'll share these slides for people who are interested. We'll share these slides so that people could also ask us questions even by email after this meeting. So, Chair, I want to pause here and thank you very much for giving me this opportunity. Thank you.
Thank you so much, Dr. Amisi. It's just unfortunate that we're starting to run a little bit over time. So sorry about cutting it a little bit short. But we are going to share the presentation with all the attendees, and whoever needs to further communicate with you and ask you questions, they are able to do so via email. So thank you so much, Dr. Amisi, for your kind presentation. I just wanted to say one or two things that I stole from your presentation, specifically talking about health of healthcare workers, the infections and the deaths, and also looking at measures how we can strengthen surveillance, especially at ports of entry, and harmonizing policies across the borders. And I think if we work together, we will be able to harmonize the policies and be able to fight the pandemic and stop the spread. So thank you so much, Dr. Ambisi. We have now reached the Q&A session. May I kindly remind you to type your questions, please, on the Q&A window. So there are two windows. There's a chat window and there's a Q&A window. Chat is just for general chats. If you have problems, you can't hear us, or the volume is low, or any general chat, but specifically for questions for this session, we need you to type your questions under the Q&A window. Otherwise, we will miss them if they are in the chat. For this session, then, I think it's proper for me to introduce the panelists that are going to help us with addressing all the questions that are being filtered. So we have three panelists for today's session. The first panelist is Dr. Tutula Balfour. She is the Head of Health of Minerals Council South Africa. The second panelist is Dr. Kanile Baloyi, who is the Deputy Head of Health, Minerals Council South Africa. And our third panelist is Dr. Pride Chigwedere, who is the UNAIDS Senior Policy and Strategy Advisor. So for this session, Dr. Pride will take us through. I believe he at least has one question that we need to address now. So over to you, Dr. Pride Chigwedere, if you could just lead us into the first question.
Thank you very much, moderator. We have questions in the question and answer box, and then some of the questions have been answered. For example, the question from Dr. Moloko has been answered by the Minerals Council as well as UNAIDS. There is a longer question from Martin Kramer. A response including statistics will be emailed to all participants. We've got a clinical question from Carol Chibi that will be referred to Dr. Kalua from WHO. So the only two questions that I will ask, I'll forward to the panelists for this session are one from Kerry Wilson. She asks that will wearing of the masks and limited social contact as is happening in the COVID times reduce or affect TB transmission? So this is a question to Dr. Amisi as well as Dr. Lusika Duchia. There is a second question, and I'm paraphrasing from Shlomoleng Mokwele. What are the responsibilities of the state, of employers and other stakeholders to migrant workers who contribute significantly to the economy? These are the two questions to the panelists. Thank you.
Okay, thank you so much. I will then ask Dr. Willie maybe to respond to the first question.
Okay, thank you, Chair. Yeah, if I understood the question is the participant is asking if wearing of mask is going to reduce the incidence of TB in the mining sector or cases of TB in the mining sector. So if I got that question correctly, my answer will be yes. I'm not really conversant with the mining environments, how work is done in the mining, but all I know is TB, like COVID-19, are all airborne diseases spread by droplets when people are coughing, speaking, or yeah, coughing and talking or crying like that, anything of that nature. So if somebody wears a mask already, there is a barrier. You create a barrier between you and the person in front of you. So even if you are coughing and your colleague is coughing and is having TB, for instance, has been diagnosed with TB, it creates already the barrier for the bacteria, the TB bacilli to move from him to you. So my answer is definitely yes. The mask is a good measure to apply in the mining sector, especially this time, because the benefit will be double. We'll be preventing COVID-19 and you'll be preventing TB as well. I submit, Chair.
Thank you. Thank you so much, Dr. Willie, for answering that. And maybe just to add, there have been anecdotal evidence that even the rates of influenza have actually reduced. And part of the reason could be that everybody is wearing masks. So there is evidence that it can reduce transmission of other infectious diseases as well. Thank you, Dr. Willie. I hope Dr. Wilson has been answered. So for the second question, Dr. Pride, if you can just lead me into who's going to address the second question.
Any of the panelists. So the question is on migrant workers and the responsibilities of the state, employers, and other stakeholders.
Okay, any of the panelists who wish to take over that question, address that question?
Thank you, Madam Director.
You, Mr. Paliano? Okay, thank you.
Yes. I can try to respond to that question. Suffice to say that the question of migrants in the region, it is a topic that we have been grappling with for quite a number of years when it comes to rights of migrants and so on and so forth. It's not just on the COVID-19 aspect of it, but generally, migrants are discriminated against in the region and probably across the continent in our countries. And there have been, as trade unions, we have had various interventions and programs and engagements with governments and employers on the protection of the rights of migrants and also pushing for decent work for migrant workers in all our countries so that they are not discriminated against. These discussions or such kind of discussions led to the formulation and the formulation of, or discussions towards the formulation of what we call labor migration policy framework for the SADC, which tries to address the discrimination of migrants in the region and how to protect the rights of migrants, especially the migrant workers, such that if we were implementing that policy framework to its latter, then these issues of COVID-19 that are emanating now when it comes to discrimination of migrants would not have been, or probably would have been minimized. So there's a broader challenge in the region when it comes to rights of migrants, not just on COVID-19, but in many respects. There's been violence and, against migrants in our countries. I think we have been following throughout in various countries in the region, migrants being attacked and so on and so forth. So the COVID-19 comes within that context of a terrain that already is hostile to migrants generally, at state level and even community level. For example, in other countries, we have had situations where even when it comes to ARVs, right, migrants have been discriminated against. Only citizens are given the ARVs as a treatment for HIV freely. But for migrants, then they'll say, no, go back to your country. For us, we are responsible for our citizens. So this is a health program meant for our citizens, and we are spending for our citizens. So although you are a resident here, all your papers are okay, but go back to your country where you should be accessing the ARVs and so on and so forth. So you find that it's not just on COVID-19, but it's general. And until probably when our member states start to take strides towards addressing the plight of migrants in our region, towards ensuring that the rights of the migrants are protected as enshrined in the international instruments on migrants, probably then some of these issues or discriminatory tendencies would be avoided or minimized, as we see happening with regards to COVID-19 pandemic. I think, Madam Director, I can stop there. I don't know whether I've tried to respond to that question properly. Thank you.
Thank you so much, Mr. Paliani. I think should the person who asked the question still need to have further discussion with you, we are open for them to drop an email so that they can get more clarity. So thank you so much for addressing that question. This brings us then to the end of this session. I see on the Q&A, there's still a few more questions. And as I said earlier on, we are going to address each and every question. And when we send you a note after the seminar, a few days after the seminar, we will send you answers to these questions to all of you. So we apologize that we can't address all the questions on this live chat in the interest of time, but we will address them in a different format, and you will get the answers later on. So thank you so much. The session is now concluded, and I'm going to hand over to my co-program director, Mr. Simpiwe Mabele, to take us through now the second session. Thank you so much for you've been a very good audience. We didn't have a problem, and thanks to all the speakers that have highlighted the deficiencies in our health systems and also the impact, the negative impact COVID has had, especially on TB and on workers' health. Thank you so much to everybody. I'm signing out. Thank you.
Yeah, thank you very much, Spore. Colleagues, I'm going to have to start with an apology. We actually 27 minutes are behind schedule. I was supposed to come in at 12. So I really want to make a plea with you that we will try to catch up with the time. I have actually received confirmations from all the speakers that I'm supposed to moderate. And they had indicated that they will actually not spend more than the time allocated. At this point in time, we actually have reached part B in the last part of this webinar, where we would like to focus on some practical solutions that could really assist not only the mining industry, but the other industries as well that would like to follow suit in terms of what Masoyise Health Program has done. And in this part of the discussion, we actually have very important guests as well, similarly to the first part. And I have an honor and to invite for this discussion, Dr. Shannon Hayder, who is the Deputy Executive Director of the UN Joint Program on HIV and AIDS, commonly known as UNAIDS. Dr. Hayder joined UNAIDS in March 2019 as the Deputy Executive Director responsible for program, and she is the Assistant Secretary General of the United Nations. She leads the UNAIDS efforts in promoting an expanded and integrated United Nations system response to HIV at the country, regional, and global levels. And she also provides the strategic direction, advocacy, coordination, and technical support, which is needed to catalyze and connect leadership from governments and communities in order to deliver life-saving HIV services. She's a public health physician and her career has reached across research, program, policy, and politics. Dr. Hayder brings to the position more than 20 years of international experience in global health, from responding to HIV and infectious diseases to strengthen health systems. She has also served in key health leadership roles, emphasizing accountability, scale, and impact for sustainability responses. Dr. Hayder, please unmute your microphone and address our guests. Thank you very much.
Thank you so much, Mr. Chair. And I'd like to start by thanking the Minerals Council and the project for inviting us to participate here. What a great program you have. And it's just an honor to be part of the presenters. All protocol observed. I would like to really touch, I think, on 3 issues in terms of what we make of where we're at, what we can learn, and where we're going. First, talking about the importance of South Africa's example in AIDS and the COVID response to the world. Catching up a little bit about where we are now that we didn't expect to be. Also to recognize some of the achievements of the Masoyise program and talk about how both of those things, when we look to the future, help us apply lessons for broader impact on people's lives. So as I think almost everyone online here knows, South Africa is the country most affected by AIDS in the world. Accounts for 20% of people living with HIV globally. But the country's also risen to become really a leader in the response, with more than 5 million people on ART before COVID, and has made progress in the 390s, being at 93% of people living with HIV know their status. And so certainly we at UNAIDS applaud South Africa and Dr. Zweli Mkhize of the Ministry of Health, the Minister of Health, who of course is joining us later, and the South African National AIDS Council for this leadership in the AIDS response and for broader health in South Africa. South Africa's demonstration of leadership in the AIDS response, including its funding 80% of its own response, really needs to be held out even more frequently as a leadership achievement. And I would make a pitch, especially to other middle income and upper middle income countries, other BRIC countries. The leadership paired with the investment, paired with the achievements of those investments, really needs to be a model for these other countries to accelerate and do more. And so when COVID-19 came on the scene, we all held our breath. But of course, we've seen South Africa also becoming not just highly affected, having registered over 700,000 cases, but really implementing a really timely risk-adjusted strategy informed by science, trying to balance economic and other needs, and to implement in that way that has us hopefully back on the track of recovery and better prepared for whatever comes next in COVID. But both HIV and COVID together have really given us even more examples to learn from HIV, TB, the responses. You know, UNAIDS, we modeled at the beginning of the COVID epidemic that if HIV-related services, such as treatment services, were interrupted for, let's say, just 6 months because of COVID, we could see a doubling of deaths from AIDS in sub-Saharan Africa alone. 500,000 extra deaths. We could lose a decade of progress against HIV in just 1 year, taking us back to 2008 death rates. I think everybody from the front lines knows how easily it could have been to see this, with services disrupted, patients unable to get to facilities, difficulties refilling medicines, laboratories and clinic staff being moved and overwhelmed. Yet I have to say, we are monitoring service interruption around the world quite routinely, and we've seen a lot less than that worst case scenario. And we've seen services starting to get into recovery and to get back on track. And certainly we have seen South Africa be a leader in those innovations and those service recoveries that have helped us all respond to the challenges of COVID, whether it is putting in strategies that make more efforts to reach people where they are rather than bringing people to facilities in this time, whether it's leveraging some of the interventions that Dr. Lichika mentioned in her earlier conversation about digital platforms, mobile services, and eventually artificial intelligence. These lessons put into play have been incredibly important. I think COVID really just re-emphasizes both that value of continued agility or innovation to meet the needs of people, but also how important it is to continue to build resilient health systems that can shift and move when something new like COVID comes along. And maybe shifting a little bit to part of the original forming of this meeting, just want to applaud the Masoyise program, the details of which we heard a little bit at the launch of this session. This has been a great initiative bringing together health leaders of minds, big and small, to work together to respond to TB and HIV in health. It's been an honor for the UNAIDS program to participate in this, to co-sponsor the publication of this great work that you're doing, and to learn how the private sector can be a leader in innovation for TB, AIDS, and the broader health response. And yes, I think part of the success of this program has been bold targets. You know, we all know when HIV came onto the scene in South Africa and the region, mines were known as hotspots of both HIV and TB. Today, I think this program itself shows that by putting in targets that are higher than national and international targets, you know, targets to counsel 100% of employees, not just part of them, annually, and to screen 100% of employees for TB annually, to use the cough questionnaire, to reduce TB incidence in mines below the national average by 2024. These are important and bold targets, and this joined up partnership to take this on, and I think to continue to innovate to deliver on that is really key. And so as we look to the future, how do we apply these lessons, both from Masoyise as well as from the agility that we've seen under COVID? Well, you know, this is an important year for the world when it comes to its commitments in the battle against HIV and what comes next. 2020 is the end of the current sort of targets for the world, and we are in the process of developing the next strategy for the next sort of global response to HIV and AIDS and the targets for 2021 to 2025. And it's really important that everything we've learned, we've heard a lot today. What are some of the specific challenges for different populations that mean we need to have a differentiated response? We've heard about some of the specific challenges, not just for mine workers today, but migrant mine workers, where they're coming from, where they're going to, their communities writ large. We've heard about some of these innovations. And so, you know, as we've been going through the process of setting the strategy, a lot of our queries and investigation has been on how we accelerate and move forward. How do we do better at reducing inequalities, making sure that we find people who are left behind and reach them in new ways? And I think the model of the Masoyise program is a great example on how to partner with bold targets. It's shown us this mutually beneficial partnership between employers and employees. It has incorporated relevant government departments for guidance, included international normative agencies and other stakeholders in the partnership to help really show us how to translate these ideas and this partnership into a funded work plan that produces results to control AIDS and TB. And that I hope through this partnership will continue to grow and to innovate and to develop new targets and new hows as the first set of targets are achieved. It also really gives us an illustration that this is an intervention that might start with the mine worker and contractors, but then extended beyond the mine itself to the communities where workers come from, to their families and where their families are, recognizing that mine workers often come from other provinces or neighboring countries. It shows us an approach to reaching people and communities that is beyond just who you touch first in your own environment. And then finally, I think my last point, you know, in the HIV response and frankly in the health response, we've often struggled with how to reach men. Much of our health system was not traditionally designed to reach men routinely. And so the package, of course, we know that the bulk of mine workers tend to be predominantly men. Having successfully reached men in this sort of gendered employment in the mines gives us a great example that we can improve outcomes this way. So it raises questions for the future. You know, how do we now reach all the men in construction sector or in the transport sector? How do we mimic this partnership between employers, employees, and other stakeholders? And so I see, at a time where we're very stressed about COVID and what comes next, about the unpredictability, I see a power in these partnerships and the agility and achievements we've managed to achieve even during these difficult times. And I just look forward to building on what we can learn from you all and moving forward together. Thank you.
Right. Dr. Hayder, thank you for keeping to your promise in terms of time. And thank you for the highlights you've made. I do not want to dilute any of the messages that you've made. Thank you very much for addressing our guests. At this point in time, I would like to shift a little bit. We were supposed to have Mr. Alat Fenlur from the ILO, but I would like our guests to bear with me, and we had indicated earlier that there's another guest that we were expecting, and this guest is ready. And I have a pleasure and an honor to really welcome the Honorable Minister, Dr. Zwelini Mkhize, the Minister of Health in the Republic of South Africa. Honorable Dr. Zwelini Lawrence Mkhize currently serves as the Minister of Health in the Republic, having been appointed to the post in May 2019, returning to his first love, medicine and quality health care for all, especially the poor. Dr. Mkhize is a medical doctor by profession and completed his MBCHB degree at the University of Natal in 1982 and has worked as a medical doctor at Edendale Hospital in Pietermaritzburg, KwaZulu-Natal, and Temba Hospital in Kabokweni, Mpumalanga, as well as in Swaziland, which is currently known as Eswatini, and Zimbabwe during his period in exile. He was earlier this year elected as the Chancellor of the Sefako Makgatho Health Sciences University, following service as a Chancellor of the University of KwaZulu-Natal from 2009 up to 2017. A devout servant of the people, Dr. Mkhize has distinguished himself through diligent, meticulous, and hands-on approach to his work over many years in various portfolios in which he served. Honorable Minister, welcome, and please unmute your microphone and address our guests. Thank you very much.
Thank you very much, Program Directors, Dr. Spo Halamono and Mr. Simpiwe Mapele, the Director General, the Department of Minerals Resources, Advocate Thabo Mokoena, the Vice President of Minerals Council of South Africa and Chairperson of Masoyise, and our host, Ms. Zanele Matlala, Executive Director of Stop TB, Lucia Dichiu, Deputy Director, UNAIDS, Dr. Shannon Hayder, Director, Sectoral Policies, International Labour Organization, Ms. Alet van Lier, the Chief of Staff of the Global Fund, Dr. Marike Veyrox, WHO representative, my brother, Dr. Owen Kalua, Senior Program Officer at SADC, Dr. Willie Amisi, and the representing Mining Industry Association of South Africa, Mr. Vusma Pena, and Research and Information Officer of Southern Africa Coordination Council, Mr. Paliani Chinguo, and all our fellow speakers in this webinar, ladies and gentlemen. It is my pleasure and honor to welcome you to this important webinar on, and I quote, fighting the unrecognized pandemic, reprioritizing TB, HIV, and NCDs in the era of COVID-19, unquote. It's a very apt and relevant topic at this watershed period as we emerge from the devastation caused by the COVID-19 pandemic. I'd like to therefore thank organizers of this webinar, Masoyise Health Program, of which the department is also a stakeholder. Without a doubt, 2020 will go down in history as one of the greatest tests ever endured by humanity. In global solidarity, countries had put in place intricate and exhaustive plans towards the attainment of the Sustainable Development Goals, only for these noble aspirations to be turned upside down by the novel coronavirus. As a country, we were to go into lockdown on the 26th of March this year. It was already about 7 months ago. And in that time, our economy has been devastated and the people's life have been changed forever. We're now approaching 700,000 cases and have recorded over 18,000 deaths. Although this is the highest number of cases in our continent, it is heartening to see that we have steadily maintained a 90% recovery rate. And at this stage, our testing positivity rate also holds below 10%. The socioeconomic carnage left by the pandemic is our greatest concern. Hogan and other scientists writing for The Lancet in July already modeled the potential impact of the COVID-19 pandemic on HIV, tuberculosis, and malaria in low-income and middle-income countries. The picture they paint is concerning and warrants special attention. They found that deaths due to HIV, tuberculosis, and malaria over the next 5 years could rise by up to 10, 20, and 36% respectively as a direct consequence of the advent of the pandemic. We hope that this is the worst case scenario and that with our concerted effort, we can limit this scenario that they've described. Yesterday, as we launched the theme for this year's World AIDS Day at the Rotary Family Day webinar, I outlined the impact of COVID-19 on the public health programs for HIV, TB, and non-communicable diseases. We're very concerned to see that HIV tests fell by nearly half and that TB testing and primary health care access by carers and children fell by between 9 and 25%. Last year, we had begun to devise programs whereby screening and testing of the common NCDs such as hypertension, diabetes would be further decentralized from facilities into common areas of congregation such as churches, schools, community halls. These programs were altogether disrupted by the necessary mitigation measures to combat COVID-19. And as a result, we saw a massive decrease in people presenting for screening and testing of these conditions. And more importantly, an alarming increase in people newly diagnosed with diabetes and hypertension. I'm however pleased to inform you, all of you, that the Department of Health has devised an aggressive catch-up strategy to ensure that we recapture the spirit of the health-seeking behavior and also capitalize on the infrastructure and public partnership gains that we made during the COVID-19 surge. We'll be communicating on the details of these programs as and when they are rolled out. This webinar has a focus on reprioritizing TB, HIV, non-communicable diseases in the mining sector. This is a very critical sector in our country, which has a special history of respiratory diseases, particularly pneumoconiosis and tuberculosis. In the latter years of HIV and non-communicable diseases have also been prevalent in the sector. I congratulate the industry for its proactive adoption of the Masoyise ETP, which was succeeded by Masoyise Health Program. These programs are designed to improve industry performance by targeting improvement of key indicators of this condition. From the reports I have received, it is evident that much progress was made since the initiation of the program. The industry now faces a unique challenge where there is a possible interaction between lung damage caused by COVID-19 and the existing lung diseases in the industry. I'd also like to assume that the industry, TB, HIV, and non-communicable disease program have been adversely affected by the COVID-19 pandemic, similar to other programs worldwide. I believe that this webinar is therefore timeless. We have with us an array of eminent specialists that can contribute in advising countries and the mining industry on how best we can turn our attention back to the diseases that have been proven over time to cause the highest morbidity and mortality amongst community members who work in the mining industry. I therefore welcome everyone to this webinar and wish you all the very best in your deliberations. As a department, we are keen to study the recommendations emanating from this conference so we can integrate and align excuse me, and align in a cohesive response to the public health challenges that face us as a collective striving towards the attainment of universal healthcare. The key message here is that of partnership with industry, the labor movement, the government, and the communities, so that we can actually defeat the scourge of TB and all the other associated ailments. Thank you very much.
Honorable Minister, thank you very much for your kind words. And we really appreciate for you sparing the time to be with us. And I have taken all the messages you've indicated. And I think one of the key messages was when you are responding to some of the questions we have received as organizers, where we were asked, this initiative, is it involving communities? Is it involving organized labor? And thank you for reflecting on that, Minister. And we have no doubt that when we are working with another industry, other than the mining industry, you will not hesitate but to join us. Thank you once again, Minister. We appreciate it. Ladies and gentlemen, we also want to thank the Minister for actually being exemplary in terms of the time, because he also had confirmed that he will definitely not take more than the time allocated to him. And thank you for that, Minister. At this point, I would like to invite a colleague from the International Labour Organization, Ms. Alet van Leur, who is currently the Director of the Sectoral Policies Department, commonly known as Sector. She is based in Geneva. And Sector, whose work cuts across all 4 strategic objectives of the ILO's decent work agenda, promotes decent work and productive employment in 22 social and economic sectors and industries, including health. The department also contributes to the ILO's work on the promotion of decent work in global supply chains, as well as on the future of work in specific sectors, including mining, including health as well, and other sectors. At this point, I am going to request one of my colleagues, because I know Alet has a 1-minute video that she would like to show. So before she speaks, I just want to request if we can play this 1-minute video, and then she will come in afterwards immediately. Thank you very much. Kirsten?
The COVID-19 pandemic has led to a crisis in the mining sector globally, with negative impacts such as declines in demand and commodity prices. Not only do local mining operations provide jobs to women and men in remote communities, they also play a critical role in global supply chains. The successful implementation of the checklist depends on active cooperation and social dialogue between mine management, supervisors, workers, and their representatives. Together, they can prevent infections and save lives.
Alet, please unmute your microphone. Thank you very much. Over to you.
Thank you very much. I would like to thank my colleague, Simpiwe, and I would like to say all protocol observed. I would like to thank the Minerals Council South Africa and its Masoyise health program for the kind invitation extended to the ILO to discuss the COVID-19 pandemic, and of course its effects on the world of work in general, but in particularly in the mining sector. The COVID-19 pandemic has devastated the world of work. In addition to the threat to public health and lives, economic and social disruption threatens the livelihoods and well-being of millions of people. In the first 9 months of 2020, the virus has taken over 1 million lives and plunged the world into a human, economic and social crisis with a loss of working hours equivalent to over 500 million full-time jobs. Global labor income is estimated to have declined by 10%, or US dollars 3.5 trillion during the first 3 quarters of 2020. Around 436 million enterprises in the hardest hit sectors worldwide, such as travel, tourism, entertainment, manufacturing, are facing high risks of long-term disruption. The pandemic is constantly evolving, and the situation differs from country to country and from sector to sector. However, there are 5 key challenges in the world of work that we must address globally and in each country. First, we need to find the right balance and sequence of health and economic and social policy interventions. Second, we must ensure that policy interventions are maintained at the necessary scale while made increasingly effective and efficient. Thirdly, we need international solidarity and support, especially for developing countries. And fourth, the virus does not discriminate, as we all know. It doesn't discriminate between its victims. However, it discriminates brutally against the poorest and the powerless. We must target policy support to vulnerable and hard-hit groups. We already heard earlier today the discussion about migrant workers. We very much agree that we must target policy support to particularly also this vulnerable group. And lastly, we must invest in and use social dialogue as an effective mechanism for responding to the pandemic. The mining sector has also been very hard hit. It sustained several price shocks earlier on in the pandemic. For many commodities, prices declined between 5 and 25%. This was followed by lockdown measures, as discussed earlier. In South Africa, this had a strong impact, not only on mining operations, but also on the mining supply chains and mining communities. The challenge now is how to deal with the demand shocks. These have also varied widely for different commodities and their different end users. The prosperity of the mining sector has always been linked to the growth of the global economy. So a lot will depend on how quickly we get that back on track. We still don't know what the next normal will look like at this stage. But for now, mineral-rich countries and mining employers and workers are navigating an uncertain future. On a more positive note, the mining sector is in it for the long run. And given its resilience and experience, the mining sector is well placed to support the longer-term economic recovery. It continues to operate and support the livelihoods of women and men. There are tens of thousands of enterprises in its supply chains. And mining companies are uniquely placed to build long-term community resilience by providing jobs and supplying vital goods and services needed in some of the most remote regions on Earth. Mining is also a sector that has experience in managing epidemics. This includes the response to tuberculosis and to HIV. And unlike other sectors, mining is familiar with implementing efficiently and effectively vital safety and health protocols and measures. Just think of the guidelines and support that the South African government, trade unions and the Minerals Council have produced since the outbreak of COVID-19. In isolating mining areas, mine-operated health facilities have saved countless lives. This can and should be supported to expand access to testing, trained medical professionals, and personal protective equipment. Even though we have perhaps become better at fighting COVID-19, there's so much more we need to do to stop the virus. And at the same time, we must not forget our unfinished business to fight tuberculosis and HIV, since these diseases thrive upon and reinforce each other. Indeed, these are the three key messages today. We must fight the three diseases together. We must do so in each and every workplace across South Africa and the world. And we can only effectively stop these communicable diseases if the three constituents of the ILO, we heard a discussion about that before, governments, employers and workers join forces in an open dialogue about policies on safety and health to ensure maximum protection and effectiveness. We have the tools to prevent and control COVID-19, tuberculosis and HIV in the world of work. Together with the World Health Organization and other partners, we have developed international guidelines on tuberculosis management in the workplace. These outline how any business, large or small, can manage and control this debilitating disease. 3 months ago, we published the ILO Mining and COVID-19 Prevention and Control Checklist that was presented just now in our short video. It has been promoted by the International Council on Mining and Metals and by the Industrial Global Union among their members worldwide. This is another example of how by working together, employers and workers can prevent new infections and save lives. More recently, the ILO published a brief on the impact of COVID-19 on people living with HIV/AIDS. It builds on the ILO Code of Practice on HIV/AIDS and the world of work, and on work done here in South Africa and elsewhere. To fight HIV in the workplace, it makes recommendations for how we can ensure that our response to COVID-19 becomes integrated and more inclusive. And while there is much the mining sector can do to prevent and control COVID-19, tuberculosis and HIV, it all depends on a strong and resilient public health system. This means having health facilities that are well equipped. And it means that all health workers must be protected with up-to-date training on how to respond to the pandemic, adequate personal protective equipment, access to mental health support, and be free from discrimination due to their COVID-19 or HIV/AIDS or other health-related status. We know that the world of work is changing profoundly and rapidly, not only because of the pandemic, but also because of globalization, digitalization, automation, and climate change. But whatever the future brings, we also know that ensuring safe and healthy workplaces is key to advancing full and productive employment and decent work. So let us make sure that this guiding principle is a shared commitment and at the center of our policies and practices going forward. Thank you for your attention.
Thank you so much, Alette. We really appreciate this, and thank you for reflecting on practical examples and contributions, particularly the work of the ILO and linked to the decent work agenda. I am not going to waste time. I want you, Alette, to be on standby because I just have one speaker, and then I'll invite my colleague who will moderate a question and answer session because the Honorable Minister is still with us. And I am aware that he has to leave in the next 15 minutes. And we would like him to be part of this dialogue that we're gonna embark on. At this stage, I would like to invite a colleague, Dr. Owen Kalua, who is the resident representative of the WHO in South Africa. He specializes in epidemiology and preventive medicine and has over 20 years of experience in public health, particularly work on HIV and AIDS, epidemiological surveillance, strategic planning, program development, and monitoring and evaluation. He joined WHO's regional office for Africa in 2002 as an advisor for HIV program development. He also worked in Botswana as the WHO medical officer on HIV, and in both Eswatini and Ghana as the WHO representative before resuming his position in South Africa in February 2020. Dr. Kalua, I would like you to unmute your microphone and please address our guests. Thank you very much.
Thank you very much, Simpiwe and the organizers, the Honorable Minister of Health, and also the Ms. Zanele Matlala, the Vice President of the Minerals Council, and all protocol observed. In my presentation, I will look at the extent and causes of essential service disruption, and I'll do that quite quickly because it has been covered already by previous speakers. I'll look at some proposed solutions and then conclude with some key messages. Next slide, please. On this slide, I would like to highlight the problem and extent of COVID-19, just to say that COVID-19 continues to seriously impact countries globally and here in Africa. And even though in the WHO Africa region, we contribute a small percentage, 6.7% of cases and 2.4% of confirmed deaths. However, we know that the real magnitude of the disease could be much higher than this because of the extent to which testing is done in some countries or in some settings. And major health systems and essential services disruption has occurred, particularly with over 35,000 healthcare worker infections that have taken place in the region. And there have also been a rise in non-COVID morbidity and mortality during the period of COVID-19. Medium to long-term health impacts and economic impacts have been estimated to be quite high. And also, it has been estimated that over the next 5 years, there will be increase in deaths due to COVID, due to the impact of COVID. And these deaths will be deaths related to HIV, TB, malaria, as well as NCDs and other conditions. Next slide, please. Well, in this slide, basically, what I want to show is that there has been some projection studies that were made earlier on the impact of COVID in terms of service disruptions. WHO, UNAIDS, and others have made estimates regarding the impact on HIV as well as on TB. And it was shown that 6 months disruption of ART could lead to over 500,000 extra deaths from AIDS-related illness, and also including from tuberculosis in the sub-Saharan Africa. And this was quite important because it was important for the necessary advocacy that was required, that as we begin to respond to COVID-19, despite its seriousness, that countries should not forget to take into account the importance of continuing health services. Next slide, please. On this slide, I focus on non-communicable diseases. Again, very briefly, but just to highlight that chronic underinvestment and the COVID pandemic have exacerbated the health impacts of non-communicable diseases. For a long time, non-communicable diseases there has not been adequate investments in them. And COVID has come at a time when we have had suboptimal services across the countries in non-communicable diseases. And yet, non-communicable diseases are the key comorbidities that are determining the severity of disease for COVID-19, as well as the outcomes in terms of COVID-19 recovery or deaths. And the one other point I would like to raise here is that when you look on this, the graph on the right-hand side, you find that even in younger ages, we are having quite considerable proportions of them having comorbidities associated with the non-communicable diseases. And at the same time, you look also at comorbidities like asthma and chronic respiratory diseases. You look at HIV, you look at TB, they're all part of and parcel of that. And these are conditions that are also quite prevalent within the context of the mining sector. So it is quite important that we look also very much at addressing non-communicable diseases, not only in terms of the short term, but also the long term in ensuring adequate investments in these non-communicable diseases. Next slide, please. In this slide, I just want also to just show that within the region, in terms of the disruption, that there has been a number of NCD services that have been disrupted in the region, and several causes have been attributed to them. And among them, one of the major ones is decrease in outpatient volume due to patients not coming to the hospitals. Because one of the other things, this tends to be chronic, and they tend not to cause immediate disease. And because of that, most of the patients would not go to get the services. Meanwhile, they had these underlying conditions. And I don't have the slide here, but there's also evidence that a number of COVID-19 patients were found when they went on for treatment for COVID, were found to have the underlying NCDs that were not known before. And this calls for the importance of the need for screening services for NCDs to be available to the population. Next slide, please. I thought I should also talk a bit about disruption in immunization services. Immunization services have been highly impacted, and in fact, one of the most affected. And the reasons have been issues of restrictions, the suspension of outreach during lockdown, as well as fear of going to hospitals. People are not sick, especially when they're going for routine immunization services. And in a number of countries, there has been postponement of campaigns. And also, in a number of countries, some campaigns have been suspended. And the result has been an estimate of at least 37 million children that have missed vaccinations due to postponement of preventable and reactive mass vaccination campaigns, which is a point which again illustrates this extent to which essential services have been disrupted in the era of COVID. Next slide, please. All right, so countries, almost all countries in our Eastern Southern Africa region have reported some form of disruption of essential services. And the most affected services, of course, have been the immunization, reproductive health, maternal and child health, but also TB, HIV, and to some extent, NCDs. Next slide, please. And the causes have been varied and numerous, and all related to some of the measures that have been taking place to respond to COVID, but also the fear and the stigma related to COVID. The pandemic also has occurred on a background of already weak health systems in the Africa region. And this has put them vulnerable to ease of disruption, limiting the access to essential health services in the region. And in the first 3 months of the pandemic, disruptions were noted in almost every essential health service that one can think of. And key contributing factors have been the lockdowns, travel restrictions, fear and stigma, and also the repurposing of facilities. But these are not the only ones, because I highlight on this slide in blue here, where you can be able to look and see the many causes of the disruption that have been there. And vulnerable populations.
Dr. Kalua, I don't mean to interrupt, but I just wanted to indicate that there's 1 minute, and I'm raising this because I know the minister is about to leave, and we actually had one question that we wanted to be answered whilst the minister is around. So I do have 1.5 minutes that I can allow you to. Please go ahead.
Thank you. Vulnerable populations are hit the worst, and the access to services have further been limited. Okay, so let's go to the next slide quickly. I just want to highlight that the most important thing is for us to build resilient health systems that will ensure that we deal with not only the issue of health security, but also the issue of universal health coverage. Next slide. And I'll pass this slide because it just gives details of what are the signs of resilient health systems that people can refer to later on. Can we move? to the next one. Okay, so on this one, the most important thing is for us to note that COVID-19 remains an imminent risk. And as we address the essential health service to make sure we have all of them, we should also at the same time be focusing on addressing COVID to ensure that as we have plateaued in most countries in Africa, we make sure that we have proper surveillance and we have proper monitoring to be able to deal with resurgences as they can. Because if we allow COVID-19 to surge back up, it can cause further disruption. And then we need to work on the continuation of services itself. Next slide, please. And in this slide, the most important thing is that whatever we do has to be evidence informed. We should get the health system ready. We should improve patient and health worker safety. We should remove all the barriers that are there for accessing services. We need to engage community, including good risk communication, and we need to build institutional capacities. Next slide. So in summary, COVID pandemic has changed the economies and the health systems, leading to the disruption of the health services that we have. Efforts by countries to mitigate the effects and restoration of essential health services is ongoing and must be intensified. And we need to build resilient health systems and improve access to services, which is very critical to health security and universal health coverage. Government stewardship and longer-term investments in health sector are needed now more than ever before if we are going to address the current pandemic and the future ones that might come, and at the same time, sustain our efforts towards universal health coverage. I thank you.
Thank you very much, Dr. Kalua, much appreciated. And I would like you to be on standby because at this stage, we do have a few questions that were posted in our chat. Honorable Minister, I am not sure whether Dr. Shannon Hayder of UNAIDS is still with us, but I know Ms. Alet van Lier of ILO is still around and Dr. Kalua as well. And I want to invite a face that is familiar to you, Honorable Minister, during your university days, Dr. Tutula Balfour, who will actually moderate the sessions. And I think at some point she will invite you to also make reflections on those questions. Dr. Balfour, please unmute your microphone and if you could take over for now.
Thank you very much, Chairperson, Program Directors, and welcome and thanks very much, Honorable Minister, for gracing our occasion. I will be very quick. We have two questions, one for you, Minister, and then we have got two statements from partners who are going to be telling us positive news about what they can do to support our program going forward. Your question, Minister, is there was a lot of discussion here in the presentation on migrant workers and how they have actually suffered under COVID-19 and have been discriminated against in many countries. And therefore the question is, in South Africa, for instance, are migrant workers paying for their quarantine? And if that's the case, I think the person was interested in why they would pay for those. The other question is if Dr. Hayder is still around. It is on HIV self-testing, and the opinion is sought on HIV self-testing and whether it adds value to HIV programs and whether there have been successes with HIV rapid tests. So we'll start with the Minister's response on the migrant workers. Thank you.
Thank you very much, Tutula, for the question. You have actually raised a real issue. The part of the socio-economic dynamics in South Africa have to do with this migrant nature of our mining work. This issue did become a challenge at the point when we closed down during the lockdown, when everyone had to stop operating and go home, which meant that everyone needed to move from their places of work and move all over the country. Then we started moving from level 4 to level 3, and we then said we must start bringing back the mining operations. It became a huge challenge because all of a sudden we had a large number of people who had to come back and carrying with them the risk of the exposure, which is based on the area where they come from. If you look at Limpopo, Northwest, and Mpumalanga, the numbers started rising as soon as we brought back the mining operations. And part of the problem had to do with the fact that the prevalence of the infection is not the same in the whole different provinces in the country. So there were provinces, for example, such as Eastern Cape, which had quite a high exposure, and yet almost a third of the migrant workers are coming from that area, that started feeling the pressure. And so we had to start the processes of screening and quarantine. In the first few days, it worked, but what the challenge became was the fact that the living conditions are not under control. In other words, if you found someone that the mining operation brought everyone to come and get screened, you could screen them as they arrived, but at the end of the day, they went back to the community. So they would then remain open to the infection rate that was spreading in the community. So that became a challenge for a while. In fact, I recall in Limpopo, we had the numbers moving from about 26, went up to about 170 within a short space of time. It made it very difficult to manage it. However, there's been a thorough integration now of all the communities, migrant workers, local communities, living in the villages and informal settlement, that you have to just deal with it as a community challenge. And therefore, you have to institute a track and trace program and quarantine for everybody based on the conditions in which they are, so that we can then have the cycle of infection interrupted. So at the beginning, it was a problem. Right now, it's the same like any other communities now, because you have to just deal with the fact that you have got infected people in the area. Whereas when people were coming into an area which was low infection, as we determined at that time, it became very difficult to manage it. But I think we've gone over that situation now. The problem, I think we need to look at the long-term solution. We were working on this issue when I was at Cox. I recall when we were working with the municipalities, that unless you can integrate the mine workers into the nearby communities and make it one community, then you will have a problem, because all the socioeconomic issues play themselves out in the disparity that exists between the sending province and the receiving province. So we do need to actually improve the housing so that there's more stability. Families must be working together, they must stay together, so that it reduces the need for up and down movement, and especially, except maybe for the very young ones, but those who are settled family members can actually work from that point of view. So it does take us back to the real reconstruction of our South African society, moving from the history of our apartheid past. So it's a part of a bigger issue, actually. Thank you.
Thank you, Minister. And actually, you are very correct with regard to the normalization of communities and mining employees, where we do actually find that where people are recruited from local areas, then disease rates are far lower, because if you are a migrant, then you are at risk of a number of conditions, which you would not get if you are living in the local community. I don't know if Dr. Heda is still around. In that case, I will call first Ms. Susan Prela from SAPCOA, who has a short statement on how they are going to be supporting the industry regarding, the other conditions that we have. Over to you, Susan.
Thank you, Dr. Tutula, and Honorable Minister. SAPCOA is a proud partner in the Masoyise Health Program, and we've been working with the Minerals Council for many years. As part of our support to the program, SAPCOA invite all mines to contact us in reaching men in the mining sector with a comprehensive health screening program, enabling the mines to reach the targets set out in the Masoyise Health Program. We have a structured program in the 12 Global Fund Adolescent Girls and Young Women Program sub-districts, but services are not limited to these. We especially want to enhance the program delivery to small mines with limited resources. Our offerings include the comprehensive health screening, HIV, TB, STI, blood pressure, blood glucose, BMI, as well as COVID screening. And we can also offer COVID patient and provider applications. So really, please contact us and let's see how we can support the program even further. Thank you.
Thank you, Susan. I'll now invite Dr. Ntomfikile Mjali from Oram Institute, who we also work with very closely. Over to you, Dr. Mjali.
Good afternoon, Chairperson and all protocol observed, Gwabe, Minister of Health. Thank you for inviting us to be part of this important conversation. A little bit about Oram. We're a PEPFAR-funded developmental partner supporting the Department of Health in the Northwest. We play a role of being a provincial support partner in Northwest, and we also a district support partner to the 3 districts, which is Dr. Kenneth Kaunda, NMM, as well as Bujanala. And as part of our provincial support role, we support the RSM district by extension. Now, we've already spoken around the fact that Northwest is a mining province with the Platinum Belt. So we've made sure that we are embedding ourselves within the Masoyise Health Program, understanding that large part of the population that we serve is linked to the mining sector. So we see the collaboration that we could have with the Department of Health and the mining community in various ways in order to improve the health outcomes of the community. This week, we are already doing in some parts. We can definitely strengthen some of the programs that we've already been doing, which is including availing our HTS, which is HIV counseling and testing services, TB screening services, and referral to appropriate care for community during the campaigns, assisting with the index testing services for contact of HIV positive clients, and also the uninsured, including the children and uninsured partners, assisting with accessing the complete package of the art care, which is including safe access to safe ARTs for employees of the mines who are uninsured and through the Department of Health facilities closest to them. We see a role also in assisting with accessing the services that we've already offered to the Department of Health, which is a home delivery project where we support the department and the facilities with making sure that the patients get their medication, even if they are not able to come to their facilities. We've also installed and launched a couple of pellet boxes, which is medication, which we put in boxes as part of our external pickup points in support of making sure patients don't have to come into the facility, especially the ones that are already decanted. Also access to TB and testing and treatment through the Department of Health Services. But also on the data side, we've had engagements already around this, which is including data cleanup and capturing on the national tier.net system to enable the mining community to better monitor and evaluate the ART program. Also, as part of the provincial support, capacity building and training of the community health workers, which is linked to the mines on the current NDOH policies and guidelines, including the latest ones around TLD rollout. As well, and finally, the role that we're playing with assisting programs aimed at empowering and supporting the youth in the community through the adolescent and youth friendly services, which is district support program, and the youth health program, which is part of the overall YES program. We are still challenged, and I think the collaboration is also around how we are reaching and retaining men in care. That will be all. Thank you, Chairperson. Over to you.
Okay, thanks very much. I can see there is a lot that you are doing. But at this stage, I would love to release our minister. We all know there is a very important session today regarding our president, and so our minister needs to attend. And I would, therefore, on behalf of Masoyise and the program directors and this whole audience, like to thank the minister for his attendance, and I'll hand over to the program director, Simpiwe. Thank you.
Thank you very much, Dr. Balfour. And I can confirm that, yes, Honorable Minister, she was authorized to actually say thank you. And whenever the time comes, Honorable Minister, we can allow you maybe to join other commitments that you have. Thank you very much. At this point, I know that we had asked if Dr. Kalua and Alet could be on standby, but I am challenged by time, and I don't know how much time they have. I know they have other commitments as well, but I do want to request that I continue, because we have managed to save some time, but we're still behind. I just want us to continue to the next speaker, because we only left with 2 speakers. And at this point in time, I also want to indicate that we are going to change the program slightly because the challenges that our speakers are confronted with are different. By no means I'm saying that the challenges are important or what they have to address is more important than the other. But at this point in time, I want to invite the Chief of Staff from Global Fund, Dr. Marieke Winrocks, who became the Chief of Staff at the Global Fund in 2013. And from June 2017 through February 2018, she served as the Interim Executive Director of the Global Fund. And her distinguished career includes more than 30 years of experience in global health and development, serving in government, at the United Nations, and in civil society, and also working in various regions, including Africa, Asia, Latin America, and Europe. Since joining the Global Fund, Dr. Winrocks has had a particular focus on gender and human rights, and on engaging diverse partners in the cause of global health. And before she joined the Global Fund, she was actually the ambassador of HIV/AIDS and the Deputy Director of the Social Development Department in the Ministry of Foreign Affairs in the Netherlands. She earned her medical degree from Maastricht University in the Netherlands and a degree in tropical health and medicine from the Institute for Tropical Medicine in Antwerp, Belgium. Dr. Winrocks, I'm also going to ask you to unmute your microphone and invite you to address our guests, and the platform is yours. Thank you very much.
Thank you so much, moderator, for your kind introduction. And it seems that someone shared my long CV with you. Sorry for that. And thanks very much for putting up our presentation and all protocols observed. At this stage of the meeting, a lot has been said already, so I'll try to avoid to repeat what my colleagues have been said very eloquently and focus a little bit on the role of the Global Fund. Almost exactly 1 year ago, we celebrated our replenishment meeting in Lyon, hosted by President Macron, and donors committed $14 billion for the next cycle of 3 years. And we were all hugely excited for what we could do and what we could collectively achieve, building on the accelerated progress that we had seen in 2018 and 2019. So we started 2020 with lots of optimism, and we knew that it would be a busy year of grant making ahead of us, given that 70% of grants would expire at the end of this year. But we were really prepared to roll up our sleeves and get to it. And then COVID hit. We came to a very grim conclusion that the knock-on effects of COVID-19 pandemic are threatening to derail all the progress we've made in the fight against HIV and TB over the last 2 decades. The recent modeling by WHO, UNAIDS, and Stop TB partnerships, and they all have referred to that. They show that deaths from HIV, TB, and malaria could as much as double in the coming year as a knock-on effect of the COVID-19 pandemic. And it's not just a modeling, we've seen it real life, and some of the previous speaker alluded to some of the disruption we've seen at country level. It was already mentioned that childhood vaccination was the most disrupted service, which will have long-term implications for child health. But the number of outpatient consultations fell in all countries, and we've seen huge variations, but we have really seen this was a constant factor, and there were supply and demand side issues, and I will not repeat what others already have said about that. One point that was not mentioned before, I believe, is the lack of PPE, personal protective equipment, which has put healthcare workers at risk. WHO did a rapid survey in September on infection rate among healthcare workers, and the figures ranged considerably between countries, but it was in some countries up to 50% of healthcare workers who were infected with the coronavirus. Amnesty International published a report in September indicating that over 7,000 healthcare workers had died because of COVID. And the lack of PPE has led to strikes among healthcare workers about fear of healthcare workers to go to the services. There is stigma and discrimination of healthcare workers, and I was pleased that someone asked a question about that. And for HIV and TB, we've seen that services have been significantly disrupted, and both Stop TB and UNAIDS presentations gave some further details, and that, as did a lot of the other presentations. So the Global Fund is bi-weekly surveying the country level disruption, and I will show you some of these results in a minute. We see big variation between countries and regions. Up to 75% of malaria, TB, and HIV services have been disrupted. Life-saving treatment for people with HIV and TB have been interrupted in many countries, increased the risk of drug resistance and death. In some places, new TB case notifications have dropped by as much as 75%, and HIV prevention particularly has been affected badly as country outreach became impossible during lockdowns. Some countries have found creative solutions. So some of the previous speakers, Shanna and Lutika, particularly referred to those. For example, moving to multi-month dispensing of drugs for TB and HIV, to have phone calls to follow up on adherence instead of asking people to come to clinics, use of mobile clinics and combining testing for COVID-19 and TB, and engaging with communities, stepping up. And we've seen in many countries that especially communities of people living with HIV or TB survivors, they really stepped up to support the COVID-19 responses. And a lot of countries have started to use virtual tools and platforms. So it's great to see that many countries could build the COVID response on systems that have been established for fighting other infectious diseases, HIV, TB, and malaria. And actually, I have to say that a lot of low and middle income countries have done a better job in tackling COVID than many of the, let's say, some of the high income countries. If we can now move the slides to the third ones, we can skip to, yeah, this one. So these are some results from our survey. So this is the tracking the disruption of service delivery. And even though we've seen a slight improvement since at the beginning of August, we still see that around 21% of the countries are experiencing high or very high disruption on HIV and TB. And you can see that disruption level for malaria have been a little bit lower because it was easier to adapt some of their programs. If you can go to the next slide. Disruption of national stock. We see that between 4 and 9% of countries are facing immediate shortages. And if you look at the countries that have very low supplies, it's between, there's another 13 to 20% of countries that are very low in supplies and have less than 3 months of supply in stock. And there have been different factors that played into it. We've seen very early on how the impact of lockdowns in China and India has limited availability of key medicines. They're either produced or very active ingredients are coming from China and India. Supply chain issues really have affected stock availability, both limited air freight, but also in-country supply chain because of lockdowns. And this is really, I wanted to flag this because the interruptions in availability of medicines for HIV and TB is really creating a risk of increased drug resistance, which will have long-term implications, not just for the patient, but also for public health. You can go to the next slide. We've also seen significant levels of disruption of lab services because there was lots of replacement and disruption because labs had to focus on coronavirus testing. Then go to the next slide. Yes, so talking about what the Global Fund has done. So we immediately realized that to protect the progress that has been achieved in the fight against HIV and TB and save lives, we have to see the fight against COVID-19, HIV and TB as one fight that we need to integrate. So as part of the global response to COVID-19, we have been working with health leaders, partners and governments to ensure that the global response to COVID-19 does include some of the lessons learned from the fight against HIV and TB, including to protect human rights and address stigma and discrimination, particularly among key and vulnerable populations, to fight human rights and gender barriers to access, to engage communities in the response, and to fairly allocate the limited resources and new tools so that no one is left behind. We're also leveraging our extensive health and community network and our well-established health procurement and distribution systems to distribute new COVID tools, medical supplies, and training at scale. In response to the COVID-19 pandemic, we responded very quickly and provided up to 1 billion of additional funding. It was a combination of 500 million that was really new and additional, and up to 500 million in operational flexibilities to either use grant savings or to reprogram to help countries fight COVID-19, to shore up health systems and mitigate the impacts on HIV and TB program. So far, we have approved $806.4 million to support a COVID-19 response across 106 countries and 12 multi-country programs. And we've been able to move very quickly, and most often we could approve proposals within 10 days after submission. Of this, 806 million, 117 million has been for diagnostic tests, which allowed us to buy 2.1 million automated PCR tests. And 201 million has been for the provision of personal protective equipment, such as masks, gloves, and gowns to protect frontline health workers. Countries can still access some funding through grant flexibilities. However, as most countries have already used savings and find it difficult to shift funds from HIV and TB programs into COVID, which is also not something we'd really encourage, they expected that this source of funding will soon be exhausted. So at the moment, we're working with donors and partners to urgently mobilize an additional $5 billion, which we think would be our share in the COVID response. We are grateful for donors that have already contributed and would like to specifically mention Germany's additional contribution of $150 million, but also flagging that already this is almost deployed. More funds are urgently needed to avoid critical funding gaps in the world's most affected countries becoming weak even. The Global Fund is also a partner in the Access to COVID-19 Tools Accelerator, which is a global collaboration of organizations and governments working to accelerate the development, production, and equitable access to new COVID-19 tests, treatments, and vaccines once these become available. As part of the ACT Accelerator, we are a co-convener of the Diagnostics Partnership together with FIND and the Health Systems Connect with the World Bank, and together with NBR, a partner in the procurement and deployment of therapeutics, including dexamethasone. And together with UNICEF, we co-lead the WHO Diagnostics Consortium to negotiate pricing, procure diagnostic tests for COVID-19. We've opened our innovative online sourcing portal, bamboo.org, to all countries and organizations so that they can also benefit from our economies of scale. And very recently, we've been able to move very quickly to make the rapid diagnostics test available, which I think in quite an unprecedented move will be coming available at the same time for both high income and for low and middle income countries. If I can move to the last slide. Thank you very much. Well, I'm not going to read the conclusion because you can read it for myself, but the point I would like to make is that the social and economic impact of COVID really has been massive all over the world. And high-income countries have adopted fiscal policies that are unprecedented and have made funds available to deal with the social and economic impact at levels that basically violates all their fiscal policies. We need a similar bold response to support low and middle income countries with their response. And we have to think beyond the traditional resources, the domestic resources, domestic funding and traditional ODA, because that will not be enough. We have calculated that the funds that are needed for the Access to COVID Tools Accelerator, the total ask is $38 billion, which is a lot of money. It's less than 1% of what high-income countries so far have mobilized in support packages to deal with the social and economic impact. So we really call for an unprecedented global solidarity to support low and middle income countries as they are dealing with COVID. Thank you very much.
Dr. Vendras, thank you very much. We really appreciate it, and thank you for the messages. And I think people who are participating in this webinar, together with their partners, they look forward to some of the recently announced set of agreements by Global Fund to make available, high quality COVID-19 antigen RDT tests. And thank you for highlighting those messages. I hope you still have some time, because I just want to bring one more person who has promised that they will make their contribution very short. And after that, we will just have a quick dialogue in terms of questions. At this point in time, I want to bring organized business. Business is organized at various levels. And when I talk about levels, business is organized multi-sectorally and sectorally. Business is organized at global level, regional level, and country level. This time around, I want to invite Mr. Vusi Mabena, who is from organized business, but from a mining industry point of view. And Vusi is the executive secretary of the Mining Industry Association of Southern Africa. And he has agreed to give a perspective in line with the solutions that we are looking for from MIASA. Mr. Mabena, the floor is yours. Please unmute your microphone.
Program Director, thank you very much, and all protocol observed. Sorry, in the interest of time, mine is just going to be 2 minutes to save time so that we can also get the vote of thanks from the DG. Excuse my voice. It's a consequence of a long done operation on my sinus. What I would like to do really, just to say who's MIASA. We are a Mining Industry Association of Southern Africa, an association of chambers of mines in the SADC region, whose purpose is really to lobby on behalf of business. We actually represent the position of mining and actually stress that mining matters in everything that happens in the economy. From COVID point of view, the industry has gone a long way to actually address the challenges of COVID. You have heard the Vice President of Minerals Council. I wanted to add some things on what's happening in the region as a whole, but unfortunately, because of time, I will save that. Maybe I will send my presentation to you so that it can be shared with everybody else. With regard to TB, the mining industry is cooperating with all other sectors, both at country level and in the region, to make sure that the employees, but also the communities surrounding the mines also benefit from tracing, from treatment, and from managing TB as we go on. So we are grateful that we are part of MIASA. We are part of Masoyise as the mining industry, and the industry meets from time to time to share best practices and to learn from one another on how they deal with the pandemic, COVID-19, as well as TB treatment in the mining sector. In the interest of time, Chair, let me rather just stop here and say I will share my speech with everybody, and then so that everybody could see what I intended to say. Maybe to make it easier, I'll quickly convert it into slides and send it to Anita as quickly as possible so that it can be shared with everybody. The mining industry in the Ear region remains committed to collaborate with all stakeholders to combat the spread of the disease amongst its employees and the surrounding communities. Thank you very much.
Mabena, thank you very much. We really appreciate your inputs there. I know I have requested panelists to hold on, and I'm looking at the time and South African Standard Time, and we only have 10 minutes left. So I do want to ask you as well to just hold on, because there might be a question that is related to the message that you have provided. I want to request my colleague, Dr. Kanyile Baloyi from Minerals Council South Africa, to quickly facilitate this part of the question and answer session. And Kanyile, we do have limited time, and you had promised that you will not take more than the time I have allocated to you. Over to you, Dr. Baloyi.
Thank you very much, Chair, and good day to colleagues in the seminar. We've thus far received one question for this session, and it's directed to Mr. Vusi Mabena. Mr. Mabena, the question reads as follows: mine workers returning to work post-festive season will be required to have a negative test at the borders. The question is then, who will be covering the cost for those COVID tests? I hope I've paraphrased it well, and the owner of the question is probably listening. But that's the question, that's the gist of the question, Mr. Mabena.
Thank you very much. We know that the South African government has already announced that those who come have got to prove to be COVID negative, otherwise they quarantine at their own cost. I would imagine that the mining companies are looking at this, and I know we had this problem during level 5 when South African-based employees had to go back to Lesotho, and they couldn't go back. And when they got there, there was another 14 days, and it affected the mining companies in Lesotho significantly. And I can only speak about that experience. I'm not sure about what other mining companies at country level are going to do, but I'm sure that they would like to treat that very positively towards its employees, because they want them to come and provide their labor at their mines. In Lesotho, I know that the diamond mines in Lesotho had to quarantine their employees who are South African residents who moved over to Lesotho and had to be quarantined for 14 days. Then, instead of being quarantined at government facilities, the mining companies decided to quarantine them at their own selected facilities that were accredited by government at their cost. So I cannot speak about what companies are going to do from country to country, because it's going to depend on the conditions of each mine. So I think that is how it's going to happen, because the rules of the country are such that quarantine has to take place before the persons come back if they do not have a COVID-free certificate. Thank you.
Thank you very much, Mr. Mabena. And Chairperson, thank you. There were other questions, very elaborate questions that actually require some basic work to be done. For instance, revisiting our data and be able to respond to those questions. So those questions will be responded to later, and the responses will be circulated with the session report. I just needed to confirm to members that for those questions that were not responded to in the session, they will definitely be responded to, and watch out on your emails.
Thank you very much, Dr. Baloy. We appreciate that. And I don't mean to be pushy, but I do want to highlight that we are challenged by time, and there's another silent challenge that South Africans will be aware of, and probably other colleagues that are online will be aware of. The President of the Republic of South Africa will be addressing the nation at 2 p.m. South African Standard Time on the economic recovery plan. And we wouldn't like to compete with this important event. And therefore, I'm gonna rely on what you have said, Dr. Baloy, in terms of ensuring and assuring our guests that we will make the questions and the answers available as part of the package that we will be disseminating. So I would like all of you to allow me at this point to go towards the conclusion of this webinar. And I do want to invite Dr. Lindy Wendelu, who is the Chief Director responsible for Occupational Health Services at the Department of Mineral Resources and Energy in South Africa. Dr. Ndelu, please, could you make the closing remarks for our guests? Over to you.
Okay.
Dr. Ndelu, I do not see your microphone being unmuted.
Thank you. Thank you. Thank you, Simpiwe, and thank you, everybody. I have to apologize for our minister, who, as you all know, has been called to cabinet, and as Simpiwe has just explained, that the president is going to be talking to the country right at about 2 o'clock. I'm just gonna read through the speech that the minister was going to give to all of us. Well, the minister says through me, Dr. Zweli Mkhize, Minister of Health, Republic of South Africa, Dr. Siha Ditui, Executive Director of Stop TB Partnership, Ms. Aleta Van Leer, Director, Sectoral Policies Department, ILO in Geneva, Dr. Shannon Harden, Deputy Executive Director, Program UNAIDS, Mr. Husma Bena, Executive Secretary, NIASA, Dr. Marike van Rooks, Chief of Staff, Global Fund, Ms. Zanele Matala, Vice President, Minerals Council, South Africa, and Chair of Masoyise Health Program, Mr. Paliani Chinguo, Program Officer, Research and Information, SATUCC, and Dr. Owen Kalua, Resident Representative, WHO South Africa. Thank you all, keynote speakers and panelists, as well as active participants. You have done an outstanding job sharing with us your valuable knowledge, insight, and experience on how to approach the reprioritization of TB, HIV, non-communicable diseases in the era of COVID-19 pandemic. Thank you very much. I would like to thank the Minerals Council South Africa for organizing this virtual webinar, which discussed the hard and important topics related to COVID-19 and how it impacts on individuals with TB, HIV, and non-communicable diseases. I appreciate your excellent presentations delivered in today's discussion for capturing the essence and translating it into various recommendations on how to approach the COVID-19 pandemic in relation to TB, HIV, non-communicable diseases, which are some of the key conditions in mining that render most of our mine workers vulnerable and suffer severe complications of COVID-19. Over the past months, we have seen the disruption of fundamental healthcare due to COVID-19, and as a new disease with limited information regarding individual risk factors for an infected person with complications and needing higher levels of medical interventions. The Department of Minerals and Energy has been assessing this outbreak around the clock, and we are deeply concerned both by the levels of spread and severity. However, there has been a decline in the number of new cases as we observed during winter months. We are all concerned about the second wave, as we all do not know how it will affect us. As we know that COVID has been characterized as a pandemic, a word that cannot be used lightly or carelessly. It can cause unreasonable fear, unjustified acceptance that the fight is over, leading to unnecessary suffering and death. It is for these reasons that through Mine Health and Safety Council, we developed the guiding principles on prevention and management of COVID-19 in the South African mining industry. Through collaboration of tripartite stakeholders, that is state, organized labor, and organized business, the decision was taken to issue a communique on the guiding principles with regard to preparedness, mitigation, and management of COVID-19 exposure. This was essential as the South African mining industry is a labor-intensive with congregate settings and has both underground and surface operations. The guiding principles on prevention and management of COVID-19 issuance was followed by the development of a mandatory guideline on prevention, mitigation, and management of COVID-19 outbreak. My appreciation goes to internationally and nationally recognized experts that participated in this seminar for their views and advice to our country. We hope to leverage on many ideas that they have put forth in relation to reprioritizing TB, HIV, and non-communicable diseases in the era of COVID-19, as well as the advice that has been given to Southern Africa. I am confident the recommendations derived from this seminar will be a vital input into the work of the Mining, TB, and HIV Committee, which is MITHAC, within the Mine Health and Safety Council. Our responsibility is to carry these recommendations resolutely forward and ensure that they are placed high up on the agenda of occupational health program in the South African mining industry, especially in the coming 6 months. I hope that you all will stay committed and work for the prospect that soon we find a vaccine for COVID-19. I also hope that you will work actively to ensure that the outcome document from the Masoyise Health Program Seminar will emphasize employees' healthcare empowerment as a key area for accelerated action. Thank you very much for guiding us safely through this ambitious and compact Masoyise Health Program Seminar. Thank you.
Thank you very much, Dr. Ndelu, for stepping in, and thanks to the Department of Mineral Resources for allowing you to stand in the place of the Minister. Thank you so much. I think this now concludes our session, the whole session. And before we leave quickly, I really would like to thank everybody who has played a part in making this seminar a success. If I were to call each and every one of you by name, I would spend quite a long time. But so everyone, including the experts, that our speakers, partners, the steering committee, and the participants, thank you so much for making this a success. And to the Minerals Council as well, and also to my co-program director, thank you so much. I know we had to rush because of time, but you managed the second session very well. Thank you so much to everybody. Dr. Simpiwe, you want to take over?
Thank you very much, Dr. Sport. Highly appreciated.
Can we spray here? Spray just the
We have made, thank you, Dr. Spoor. We have made promises and commitments that we will share the materials. And fortunately, we have documented up to 100% of what Masoyise Health Program has done. So you will definitely be, or rather have access to the materials. At some point, we had about 286 people attending this meeting, including both panelists and attendees. So we thank you very much, and we will make sure that we fulfill our promises. Dr. Tutula Balfour, who is heading the team with the support of the chair of the Masoyise Health Program, Ms. Zanele Matlala. On that note, I would like to wish you all the best and goodbye.
Thank you. Bye.